We live in a world where the media likes to jump on the idea of designer babies. In a world where parents, with the help of physicians and scientists, can choose the sex of their baby, the eye color of their baby, and the hair color of their baby. And that's all possible, but in reality, all a parent wants is a healthy baby. In vitro fertilization, or IVF, is the science behind the art of creating a healthy baby. It's the process by which an egg and a sperm are combined in the right environment at the right time with the right secret sauce to create a grade A embryo. And this embryo has immense potential, but there is always the chance for complications. Every year in Ontario, over 90,000 pregnant women have prenatal screening performed. These women want to know their risk of having a baby with a genetic complication. These risks are rare, but they significantly affect the infant, the parents, and the healthcare system. The first line of screening is just a blood sample where we look at 6 markers in combination. We account for a woman's ethnicity, if she's diabetic, if she's a smoker, and how she conceived. One aspect of my thesis focuses on investigating whether we are appropriately calculating and adjusting for IVF use when we are counseling patients on genetic risk. It is well established that the risk of complication increases along with a patient's age, and that the average age of a woman who conceives naturally is significantly younger as compared to a woman who uses IVF to conceive. When a woman has an IVF treatment cycle, she has the opportunity to transfer an embryo around the same time as egg retrieval. However, often there is a surplus of embryos that the parents decide to freeze for several years for future use. So when doing prenatal screening, are we using the patient age at the time of egg retrieval in order to calculate genetic risk, or are we using the patient age at the time of the prenatal screen? To complicate this further, consider the use of donor eggs. Over 10% of IVF treatment cycles in the province of Ontario use donor eggs to conceive, and there is a 5-year difference in the average age at the time of egg collection between a woman who uses her own eggs as compared to a woman who uses any donor material. To put this in perspective, the risk of Down syndrome is 1 in 1,000 at 29, but doubles to 1 in 500 at 34 years of age. We should be using the patient age at the time of egg retrieval. It's true that this only affects a small proportion of women, given that there are over 140,000 births in the province of Ontario that occur due to natural conception. However, if we are counseling women to have an invasive test where amniotic fluid is sampled based on inaccurate screening results, we are putting these pregnancies at unnecessary risk for fetal loss. In my research, I am following every IVF treatment cycle in the province of Ontario from conception all the way through till birth, and I'll be able to conclusively state my findings. Recently, this became even more relevant as the government of Ontario decided to fund IVF in the province, and the number of women that are receiving this treatment will increase. I think it's imperative that these women have the accurate information and accurate results in order to inform the next steps of their pregnancy. Thank you.